everyone, my name is Jocelyn Miramundo from Davao Doctors College, and for today I'm going to perform the parenteral drug administration return demonstration. So what is parenteral drug administration? It refers to the drugs given by the routes other than the digestive tract. So the term parenteral is usually used for drugs given by injection or infusion. So there are five common routes of parenteral routes, which are the subcutaneous route, the intraperitoneal or the IP, the intravenous IV, intradermal ID, and lastly the intramuscular route. So for today, I'm going to do the intradermal, the intramuscular, and also the subcutaneous. So prior to the conduct of our procedure, the first thing that we need to do is we have to check the doctor's order to make sure that we have the right medication, we know the right patient, we know the right time that we need to give the medication. So we have here our doctor's order sheet, so we are just going to check them with our medication. So we are also going to check the MAR. So the MAR is the records of the medications prescribed to our patient. So we are just going to check the labels of the medication, making sure that we have the right medications given to the patient. So remember that in checking the label of the medication, we are going to carefully check it against the MAR to know that we have the right medication and it is being prepared correctly. So we are going to follow the three checks of administering the medication. So first one is that we are going to read the label of the medication. Next is that when it is taken from the medication cart, we are going to check it also, and then before withdrawing the medication and then after withdrawing the medication. So that's how you prepare the medication with the MAR. So now I'm going to organize the equipments that we need to use in this procedure. So we have here a clean pair of gloves. We also have our cotton balls here in case we run out of cotton balls later. So I also have here cotton balls soaked in a 70% alcohol. I have here my sterile water to use as my medication. And I have here my vial as a medication for the intradermal route. And then I have here my ampule for the intramuscular route. I also have here my hypodermic tray, so this will be my hypodermic tray. And I have here my blue ball pen, which I will be using later on to circle the site or the area of the intradermal skin testing later. So I also have here my tuberculin syringe, so I will be using this for the intradermal or the skin testing. And I also have here my 5cc for the intramuscular route. And I also have here my insulin syringe for the subcutaneous route. And then I have here the two filter needle or the aspirating needles for me to use later on when I withdraw the medication into the syringes. So now I'm going to proceed in performing hand washing to deter the spread of the microorganisms and also to avoid infections, and also to protect myself and also my client and cross-contamination. Since this video will be consist of three scenarios, which is the ID, the IN, and also the subcutaneous. So I'm going to do first or perform first the intradermal routes. For the preparation, I'm going to prepare all of the medications needed for the patient. So first is for the intradermal. So we have here our vial for the drug removal. So we are going to mix the solution if necessary by rotating this vial between the palms of our hands. So we're just going to rotate it like this. And then we are going to remove the protective cup if it has a protective cup. But since I have here the rubber cup, so I'm just going to wipe the rubber by rubbing it in a circular motion using the cotton ball soaked in a 70% of alcohol. In a circular motion. Then after that, we are going to discard this cotton ball. So now that it is clean, we are just going to prepare our needles. So in preparing the needle, we are just going to open this halfway and then making sure that we are just opening the barrel of the plunger and the barrel of the syringe, and then we are going to loosen up the needle of this syringe. And then we are also going to use our aspirating needle. So we are just going to grab the barrel. Okay, so now that our filter needle is, or our aspirating needle is now ready, we are now going to proceed in withdrawing the medication. So the first thing that we need to do is we have to attach a filter needle, as the agency practice takes to draw up this liquid medication from a multi-purpose vial. So we're just going to attach it inside, and then we are going to ensure that this needle is firmly attached into the barrel of the syringe. Just like this, making sure that it is tight enough to hold into the barrel. So now we are going to remove it in its packaging. Okay, so now we are going to carefully insert the needle into the upright vial through the center of the rubber cup, maintaining the sterility of the needle. So just like this. Now once it is attached, we are going to inject air into the vial. And then we are just keeping the barrel of the needle above the surface of the medication. So we are just going to withdraw the medication into the syringe with its prescribed amount. So now it's done. Now make sure that there is no air into the syringe. Okay, so we are just going to withdraw the air. Then after that, we are going to cap now the syringe. So now that the medication is ready, we are now going to dispose the filter needle back into its packaging, and then we are going to discard this into the sharp. So we are going to put back the needle tip of this syringe. So now this medication is ready. So now I'm going to proceed in preparing the medication from the ampule. We have here our ampule, so we are going to flick the upper stem of this ampule several times with a fingernail. So, making sure that all of the medication is on the lower part of the ampule. So now we are going to use the ampule opener, or we are going to place a sterile gauze or alcohol wipe between our thumb and the ampule neck to make sure that we won't hurt our fingers, or we won't hurt ourselves. So we are just going to break it, or break the top of the ampule by bending it towards us. So we have to make sure that the dot is facing away from us, and then we are going to make sure that we are not breaking the ampule in front of anyone. So in just doing that, we are now going to hold this lower part of the ampule firmly, and then we are going to break it immediately, like that. And then we are going to discard this on the sharps. Now that our ampule is ready, we're now just going to put this on the table, and then we're going to prepare our syringe. We'll be using this 5cc syringe, so I'm just going to open this, and then I'm going to unattach the needle tip of this syringe, and then I'm going to get the barrel, and then I'm going to attach this into the filter needle. So I'm just going to open this, and then I'm going to attach the filter needle into the barrel. So we have to ensure that this is firmly attached into the barrel. We are now going to proceed in withdrawing the medication. Now we are going to remove the cap of the filter needle. Now we are going to insert the needle into the center of the ampule. So we have to make sure that we are not touching the rim of the ampule with the needle tip or shaft. So we're just going to meet the needle tip and the ampule to get all of the medication. So now once it's done, we are going to discard this ampule into the sharps, making sure that we dispose it on the right receptacle. So after that, we are going to cap the filter needle, and then we are going to unattach it, and then we are going to attach back the barrel into the right size of the needle tip. So now that this is ready, we are now going to put this also on our hypodermic tray. So now after that, I'm going to proceed in preparing the medication for our subcutaneous injection. So I have here my insulin syringe. So for this one, I will be using my sterile water as the medication. We're just going to withdraw the medication. So now we are going to draw the medication to the syringe with its right prescribed units. Okay, so after that, we are now going to cap back the syringe. So now this is ready, we are also going to put this in our hypodermic tray. So after preparing all of the medications, we're now going to proceed in meeting our client and verifying our client. Okay, so now we are going to meet our client. We are now going to introduce ourselves to our client. We are going to verify the client, making sure that we have the right patient in front of us. And then we are also going to explain the procedure to our clients. Good morning, sir. I'm Jocelyn Miramundo, your senior nurse for today. So how are you feeling today, sir? Okay, so that's great. So now for our verification, may I see your wristband, please? Okay, so sir, kindly state your name and also your birth date.
Ramses August 13.
Okay, so thank you. So for today, sir, I'm going to inject you the prescribed medication that is given to you by your physician. First one is the Ketorolac 30 mg. So this medication will relieve moderately your severe pain since it is occurred after your operation. And also the ampicillin sodium. This is to treat the bacterial infections. So now, sir, I have closed the curtains and also closed the doors so that no one from the outside will disturb us. And I have also adjusted the room temperature to provide your comfort and privacy. So now, sir, I'm just going to assist you to a sitting position so that I can proceed with the intradermal injection. Okay, so now can you please put your hand here so that I can proceed with the skin testing. Okay, so now we are going to proceed in doing the skin testing. So now we are going to clean the site of the or clean the area of the skin that we will be injecting. So you're just going to clean it on a circular motion from the inside to outside. We have to remember that we are going to avoid using the sites that are tender, inflamed, or swollen in those of that have lesions. So as I have already applied my gloves, so now I'm just going to allow the area to dry as I also prepare the medication. Okay, so before we inject the medications, we're just going to make sure that there is no air bubbles into the syringe. So now we are going to grasp the syringe with our dominant hand close to the hub, holding between the thumb and the forefinger. So this is my dominant hand, which is my right hand. So now I'm going to hold the needle almost parallel to the skin surface with the bevel of the needle up. So now we are going to inject the fluid or the medication into the skin. So with our non-dominant hand, this one, my left hand, so we are going to pull the skin at the site until it is taut. Okay, so now I'm going to insert the tip of the needle far enough to place the bevel through the epidermis into the dermis. So that is 10 to 15 degrees angle. So now I'm going to stabilize the syringe and the needle. So now we are going to inject the medication carefully and slowly so that it produces a small wheal on the skin. Okay, so after that, we are going to withdraw the needle quickly at the same angle which it was inserted. Okay, so now that we are done, we are just going to circle the area and with our ink to observe the redness of the injection site. So sir, I have encircled the injection site, so please do not erase it or touch it later, okay? Okay, so after the procedure that we have done, we're going to document all of the relevant informations, just like the to record the testing material that is given to the patient, the time, the dosage, the route, the site, and also the nursing assessment that we have done with our patient. So after that, we are going to evaluate the condition of the site after 30 minutes, depending on the test. So we are also going to measure here the area of redness and the induration of the in millimeters at the largest diameter, and then we are also going to document the findings. So now we are done with our intradermal route. We are now going to proceed in doing the intramuscular route. So now I'm going to select, locate, and clean the site using the antiseptic swab. So sir, let me just lift up your sleeve so that we are going to expose the deltoid muscle. So this is where the site that I will be injecting. So make sure that we are not using the frequent site that it has been already injected. So avoid using the same site twice in a row. So now, as we have already locate the exact size for the injection, and we have already prepared the clean pair of gloves, so now we are going to proceed in cleaning the site with an antiseptic swab. So now we are going to prepare the syringe for injection. So we have here our 5cc syringe. So we are just going to uncap this. We are going to remove the needle cover without contaminating the needle. So remember that if we are using a prefilled unit dose of medication, take a caution to avoid dripping the medication on the needle prior to injection. So if this occur, we are going to wipe the medication of the needle with a sterile gauze. So now we are going to use the Z-Track technique in injecting this medication. So in doing the Z-Track technique, we are going to use the ulnar side of our non-dominant hand, this one, to pull the skin approximately 2 to 5 centimeters or 1 inch to the side. So just like this, we are going to pull the skin just like this, as you can see. So remember that under some of the circumstances, such as for infant or an emaciated client, the muscle may be pinched just like this. They do also this one for the Z-Track method. So now we are going to hold the syringe between the thumb and the forefinger as if we are holding a pen, just like this. So now we are going to inject the medication at a 90-degree angle right into the muscle, just like that. And then we are going to hold steadily the barrel with our non-dominant hand, and then we are going to aspirate using our dominant hand by pulling back on the plunger with by aspirating for 5 up to 10 seconds. And thereafter that, we are going to discard the used syringe. So now I'm going to place the alcohol swab right into the site. So now as we have already select a site, and then we are going to clean this after. So we have to make sure that the site is free of tenderness, hardness, swelling, scarring, itching, burning, or even localized inflammation. So we are going to select a site that has not been frequently used, and then now we are going to start cleaning the center of the site, widening the circle inward to outward. So okay sir, I'm now going to inject you into a subcutaneous route. So let me just expose your abdomen. Will that be okay with you?
Yes.
Okay, thank you. So now I'm going to clean the area on a circular motion, inward to outward. So now I'm going to uncup the syringe, and then I'm going to inject now the medication. So we are going to grasp the syringe with our dominant hand by holding it between the thumb and the fingers. So we are going to place this facing into a side or upward for a 45-degree angle insertion. Okay, so after that, we are going to withdraw the needle just like how we inserted it. Discard and place the syringe into the right receptacle, and then we are going to place the dry cotton ball into the site. Okay, so after that, as we have injected the medication holding the syringe steady, so as we also have removed the needle, pulling smoothly along the line of the insertion while depressing the skin with our non-dominant hand. So always remember that if bleeding occurs after the injection, we are going to apply pressure to the site with a dry sterile gauze until it stops. So after doing all of the procedure, we are now going to dispose all of the supplies into a right receptacles, just like the sharps, the syringes, and the medications, the vials, the ampule. And then after that, we are going to do the aftercare, and we are going to remove our gloves. So let me just remove my glove first, and then I am going to dispose properly all of the equipments that I have used. And then now I'm going to and also we are going to retain the materials that into its proper place, especially if we have used the MAR machine, and then we are going to perform hand washing or perform proper hygiene hand hygiene after that. So let me just do the hand hygiene. So when it is the time that we need to assess the effectiveness of the medication, we are going to go back to our client and see if there is any reaction to the medication, and then after that we are going to document all of the relevant findings. So because many agencies prefer that the medication administration will be recorded on the medication record. So now we are done with our intradermal, intramuscular, and also our subcutaneous injection return demonstration. Thank you for watching.